Now I'm going to do the foot splint using the plaster. The plaster comes in two different sizes. Like I said, for the hand, it is 5 by 30, but the foot is 5 by 45. You usually for the foot, you use from 10 to 15 in the foot, depending on the patients. And you actually come in a scenario like this, like I say, 5 by 45. You get it out of the packet. And what you actually do, again, you're going to measure the side of the patient to make sure what you're doing. And again, you're using the side where it's not broke or you have any problem. You go from the bottom of the toes all the way down, again, 2 inches from the below of the knee. And this is your measuring there. Okay, that way you know. And you rip it up. After that, you go to get your splint. So this, make sure that you measure and you have the right amount, which this is perfect. And again, I always like to cut it, kind of triangle it up or angle it up to make it easy. After you got all this done, you can get back again your wheelbarrow. Again, I'm using a 5. I need to use a 6, the wheelbarrow, and I'm going to measure it against the measure already have, and I want to give a couple inches more up. Okay, we're trying to get no wrinkle. This is 2 layers. This is 3 layers. This is the number 4. This is 5. And I usually use like an 8 to 10 in the foot. And the reason that I use like an 8 to 10 or maybe because the foot person sometimes put a lot of pressure on it and it can have sores around the ankle. No matter if you overpad this, it'd be okay because what you do is you're trying to make it comfortable for the patient. And I think this one is pretty good. You can see you have no wrinkles, it's straight, and you got a couple layers in there. Again, I usually like to cut this little, not making that thick when you bend it under the knee or under the foot. Okay, now you are ready to begin actually to do you. You need to have a 6-inch, because it's using a door. I use a 6-inch of elastic band-aid. Now I'm going to, this is a little tricky. You have to make sure that you don't lose the end of the, actually of the plaster. You're going to do the same thing. You're going to have to hold it. Let me cut this end a little bit in here. The same way I go to put it on. You have to make sure that it's all aligned. Again, make sure you hold it. You are not losing the end, and then you got to put it inside the water like an S. And you got to try to make again the bubbles go away. Bubbles aside, you got to try to bring it real nice and smooth. You can smooth it up a little bit. You can get it like an S and put it in your hand. Make sure you still hold at the end of this plaster because you already cut it in both ends and you don't want to lose it. If it's not, you're going to squeeze it all together and you're going to lose the end of the plaster. It's not going to be good to do it. Again, you squeeze it until you cannot get no more water. And again, you have to make sure that you actually get the wrinkles out. Again, this is only, you do this when you're using plaster. This is when you go actually do all this up. The water, wrinkle out. Again, you can put it on the table or you can put it in the wheelbarrow, kind of in the middle. That way you have some in the edges back here, some back here. You can smooth it out. That way you don't have no wrinkle. Again, you can fold it everything back. Now you're ready to put it. Remember, the side who's showing the plaster, that side is going outside. This part, we have the wheelbarrow, this is the part who's going to go in the patient's side. What you do is you start it from the foot. Forget about this, go to the floor. You're going to go under here You're going to start to mold it up. You can actually get your clothes off if you want to. You're going to start it from the foot. Molding this up. From the foot up. Again, you do not stress this up. You're going up, and the way you're going up, you mold your plaster. Let the patient put the foot down, and put it at 90 out there like you are walking. And you go around in circle. At the same time you're going up, you're going to be doing this, the same thing, because what it does is you are molding the plaster. No matter if it fell a little bit, you can go back. Like again, plaster, it gives you enough time to do it when you actually need to do it. Have to make sure that foot is at 90. Make sure you mold it again, not using your fingers, using the palm of the grip of your hand to mold this up. Again, like you see, you'll notice in the back, you got 2 fingers from the top of the knee, which is excellent. And I need to put another one. If I put in the second one, I usually go to start it from the top to the bottom to make it a little bit more stronger. Again, do not stress this up. Give it normal, 1.5 all the way down, kind of quick. You want to get to your ankle and go to the mid foot with the second one. That way you can actually put it a little bit better. Only thing you have to do is actually hold it. And remember, use your hand, not your fingers, and you let it sit in there. You have to be careful when you actually mold in this area in here. This little corner, you are not bending or put it too much inside there where it's not supposed to go, because you can make a pressure sore in there. And you can actually mold the Achilles tendons in here a little bit to make it get the form of the foot. You can actually mold it under the foot too. That way the spring's going to get the same way the foot look like it. And you mold it all around her foot. And this is what they call a short plaster splinting. This is what it is. This is the way to look. And you want to actually lift the foot up. That way she can have freedom to move the toes without no problem at all. And this is the splinting of a short leg cast.